So my exercises for my patients probably really don't look that different from the exercises that you all are currently utilizing for your low back pain patients. I have people doing things like bridging and, Sarman progressions and all of these things. It's just that we include a pelvic floor cueing component. And your best friend, actually, when getting the pelvic floor to function optimally, is actually breathing patterns, believe it or not. I always say when I'm teaching, I'm like, how many of us have ever said something along the lines of, please don't hold your breath while you're doing your exercises. I don't want you to pass out. Or, we're joking. But at the same time, it's this well-recognized phenomenon that our patients have a tendency to hold their breath. The reason they're doing that is because if they don't have a good sort of strategy for utilizing their pelvic floor, a breath hold will brace their pelvic floor, which is not necessarily the most effective and definitely not the healthiest means of pulling the pelvic floor into the exercise they're performing, but it's better than nothing, if that makes sense. And so actually, what I start almost all of my patients on is breathing exercises, getting that diaphragm moving, because the diaphragm and the pelvic floor, again, have this synergistic relationship where when one moves, so when you breathe in and your diaphragm drops, your pelvic floor elongates as well. And then when you exhale, your diaphragm and your pelvic floor concentrically lift. And so they're doing like this as you're going through your breath cycle. And what that does is it helps create this phenomenon called intra-abdominal pressure, which is where we get our support from for movement, for our spine, for our pelvis, etc.